Nowadays, the most important thing is the information of the patient. So we have so many devices to show the patients some possible results. With the simulation, we can show them the anatomy and teach them to feel the right sensitivity before and after the operation, so we can show the risks and the danger zones. So the patient is very well informed about the pre and the post-operative time and of the possible result. If you don't do an accurate analysis, you don't do a proper plan, surgical plan, and you don't have a good result because it's like linked to the case, to the fate, no? So analysis and pre-operative simulation and program is the key to success.
I think rhinoplasty patients are a group of patients that most of the time are very demanding. And that's also something that the young surgeons should take into account and maybe take on these cases in which a major improvement is what the patient is looking for and not changing of minor details, because that last issue is one of the most difficult ones to achieve, I think.
We must play with live tissues. It means we must play with skin, we must play with cartilage, and we must play with bone. And the peoples and the patients must know that sometimes it is impossible to change everything that we want. Yes, for example, I want to change the shape of the cartilage, but during the surgery it is impossible. Or yes, I can destroy the cartilage, but the patient will not happy for the long-term result. So all of the patients must know exactly the limitations of our surgery. I'm a facial plastic surgeon, but I cannot do anything and everything for my patient. I can change the shape of the nose, the shape of the cartilage, according to the cosmetic rules and according that there is not any complication after surgery.
We cannot guarantee a perfect result. Actually, it's very difficult to define the perfect results, because I wish to achieve another appearance, the patient hopes to achieve another appearance, and it's a little bit according to your taste. You may like the results. For you, it may be the best results, best solution. But for me, I must think that I should do this maneuver a little bit more or less, because way of looking and way of thinking is different between individuals. So it's impossible. I do not advise any surgeon to guarantee the patient about the results.